Janet, I was so proud to be asked to do the foreword for your book, because I've known you now for 12 years and know what an experienced and good clinical nurse specialist you are. So I was delighted to do the foreword, because it's something that it really illustrates beautifully what you need to do. But tell me, why did you want to do a book? Why did you decide to write this now?
It felt like a good time to tell the story. And I think all clinicians, every person has a story inside them. But this book is a professional narrative that meanders through the patient and the family narrative. And there are some aspects of learning that can't be taught. And I think the richer you're experienced, the more experienced you are, then the fuller and more meaningful that script becomes, and it's important to get it down. It's the least academic book. I hope it's got some warmth. I hope it makes sense to the reader. It isn't UK specific, it's not religious. It covers the sad issues, it covers the difficult issues, but hopefully it's an ordinary nurse's story, working in specialist practice, that I think will transfer to any professional interested in palliative care, working anywhere. And it was time, after all these years and working aside, some fabulous clinicians, get this story down, let's pass this on.
And I think that came across, and what I was really struck by was, this is a do as I do book. It doesn't just tell you, do what I say, but this gives people an idea to actually say, this is how you would do it, and this is me as a jobbing nurse, this is what I do. You'll find it easier and more rewarding if you do it this sort of way. That's what really struck me.
I hope that aspect's valuable, because I've been really honest about the times that I've got it wrong. We all know the ideal, we've all read the textbooks, and we all work very hard. And sometimes I've got it wrong, and I've had to reflect on that and think, why did I get that wrong? How could it be better? How did that feel? And I'm sure I've learned more from my mistakes than I have from my successes, and all that's in there as well. So I hope in parts it's a pat on the back for professionals that work really hard with this. I hope they read it and feel good about themselves. I hope it makes them think, and I hope they learn something as well.
They should definitely do that. That will definitely achieve all of those goals.
I mean, yeah, you say it's not an academic book. Where do you think is the value in those non-scientific aspects of?
I hope it's underpinned by some good science. It's but I hope it's written in a very relaxed way, because one thing I feel very strongly about as a clinician and an educator is that as healthcare becomes more complex, and it is doing, we all know that, we're all working extremely hard, people are living longer, we're seeing multiple morbidities for people and more complex issues, then it's even more important to keep it simple. And that's what I try to do, make the complex simple, to make sense of things. I hope it makes sense to the reader. I hope we're making sense and adding value to the patient narrative. And it certainly made sense for me at this point in my career and as a person to write this book now, to tell a simple story, a very important, complex issue about a speciality that I love just as much as I did 25 years ago.
Yeah, I mean, this book isn't just aimed at nurses. People might think, oh, this is written by a CNS, this is just for nurses. As a consultant in palliative medicine, I learned things from reading the preparations for this book. I know that my colleagues working in oncology, in elderly care, GPs, in community settings, they will benefit from journeying with this book and picking it up and not even having to go through it all in one go. It's that sort of book that you can pick up and have little bites off, rather than think, oh my gosh, I've got to go through this. So I would hope that other professional groups, because we're the ones generally, it is doctors and nurses who tend to have the really difficult conversations with patients, particularly regarding treatment decisions and that. So I would hope that they will get the most from the book, but I think other professionals that go alongside the patient journey will also learn from it as well.
I hope so. I know I speak as a nurse, and that's inevitable. That's, you know, it isn't what I do, it's what I am, and there's still a young student nurse in here talking, and I think students can pick up this book. It's easy to read, and experienced clinicians, I hope it provokes some thought there. And there are many of us, and palliative care, we know, is everyone's responsibility, and as specialists we're just a small part of it. Hospitals, 90% of illness we know happens at home. So the GPs, the district nurses, anybody, and patients choose who they want to have these difficult conversations with, and it's their story. And we need doctors to get into hospital, but you won't get out of one alive without a nurse and all the other professionals. And as much as medicine heals the body, I think telling the story can heal the spirit, and I hope it's a story worth telling.
Definitely.